And just an hour ago, China says another person has died from the virus, making it the second death. 40 others have the disease. Here in Canada, we are entering peak flu season. Health officials are working to contain it. Numbers by Health Canada reveal that influenza B is circulating at higher levels than usual, and they're urging people to get vaccinated. There's a strong example tonight of just how overwhelming the numbers can be. Some elective surgeries are being canceled at the Children's Hospital in Winnipeg because of the spike in the flu. The director of the Child Health Services issued this statement today. Since mid-December, HSC Children's has admitted 120 children and babies with lab-confirmed cases of respiratory infections and other influenza-like illnesses, including respiratory syncytial virus, RSV, influenza A, and influenza B. Taking your questions about the flu and the coronavirus tonight, live is Dr. Theresa Tam. Dr. Tam is Canada's Chief Medical Officer of Health. She is also a physician who specializes in immunization and infectious diseases, and she joins me from Ottawa. Dr. Tam, welcome to you.
Very pleased to be here.
Let me begin with a couple of questions about the new coronavirus before we move on to the flu. What's your reaction to the emergence of this new strain?
Well, I think my first reaction is, having been part of the SARS response in 2003, the authorities in China actually reported this unusual cluster of viral pneumonia very quickly. The virus was actually identified and sequenced also very rapidly. And at this point in time, the authorities locally have done a whole number of measures to try and contain the spread of this cluster. So, my first impression is that we've managed to detect this earlier, and as a result, be able to respond to the virus that much faster.
Okay, how do we respond when you hear things like they have their first case in Japan, they've had a case in Thailand, and 2 people have died from this disease?
Well, I think, first of all, we are maintaining very close contact with the World Health Organization and other countries so that we can learn about the ongoing evolution of information and knowledge on this virus. But the very key thing is that we've provided some information to travelers who might be traveling to Wuhan, China, advising them to avoid live animal markets or contact with animals and farms, because one of the hypotheses is that it may be linked to contact with animals in a particular market. And so we're also advising travelers to take general precautions, including certainly avoiding people who might be sick, and then essentially washing your hands frequently, particularly if you touch other animals or been sick near sick people. And if you're sick coming back into Canada, be sure to tell your doctors or health providers that you have traveled and provide the travel history. And I think the key is that I've alerted all the provinces and territories and the medical officers of health so that they are alerting the frontline hospitals and health workers to be on the lookout for anything unusual in travelers as well. And our laboratory, having received this sequence of the novel virus, working with WHO and other countries, is developing the diagnostics necessary to detect this virus should a traveler happens to come back with the virus.
Just one last question on the coronavirus. If it were to get out of control, how devastating do you think it would be?
Well, I think it is extremely early to tell. So far, we've heard of 2 deaths among approximately 40 plus cases. And so I think we don't know yet. And we heard that these deaths are occurring in persons that have underlying medical conditions or maybe a bit older. So I think we are trying to get more handle on the epidemiology. But just to reiterate that certainly the key to protecting Canada is some very fundamental foundational infection prevention control measures. For example, hospitals and health facilities need to make sure they ask the travel history, triage the patients, and put them in proper isolation as soon as they have that type of history and compatible symptoms. So I think we have to take this seriously, take precautionary measures, but continue to monitor the evolution of the information that's available.
Okay. A bigger threat to Canadians right now is the flu. And people have questions at home. But first, before we go to those, Dr. Tam, how would you characterize this flu season compared to past flu seasons?
Well, I think, as you said, actually, you've just made a very interesting comment. And, you know, our current risk assessment on the novel coronavirus to Canada is that it is low. The risk to having an actual outbreak in Canada at this point in time is low. Whereas we're right in the middle of influenza and other respiratory virus season, and you've seen reports of this. Right now, what we're seeing, which is a bit unusual, is the rise in influenza B viruses earlier in the flu season. So normally influenza B occurs, say, around February timeframe, after we've generally seen some influenza A activity. Right now what you're seeing is two types of influenza A viruses, H3, AH1, as well as this B Victoria lineage strain that's circulating at the same time. And I think what we're seeing is that pediatric hospitalizations have been higher than they have been in the preceding 5 seasons. Influenza B happens to, this B Victoria lineage strain happens to impact the young more severely. So that might be why you're seeing these hospitalizations and pediatric hospitals getting inundated with a lot of patients.
Okay. Is there any reason why it's having more of an impact this year?
So there's been a number of hypotheses. We haven't actually seen a predominance of influenza B for a number of years, certainly not since the 2015 to 16 influenza season. So one of the thinking is that the population immunity is relatively low to this influenza B virus, particularly kids who are just born. So the kids that are a few years old haven't actually seen this virus circulating. As well, something interesting is happening to this B Victoria virus. The virus, we've seen some genetic changes in the virus. There's been 3 deletions in this virus genome. And we think that this virus might be just trying to find a way to take off in the population by changing its genetic makeup. So there's a number of hypotheses right now, but for sure we're seeing an earlier rise in this virus. And I think the fact that it's occurring on top of the influenza A activity is why we're seeing such an upswing right now.
Okay, we have a lot of questions about the flu shot and its efficacy. The first one is from Grant, and he emailed us with this assertion: more people fall ill or die from adverse reactions to the flu shot. Why should I risk that? Dr. Tam, is that true?
No, this is not true. The complications from influenza is far more serious than any rare severe adverse reaction to the flu vaccine. So influenza, I think we have to remind people in Canada that this is not a trivial illness. So certainly, if you're young and healthy adult, you may recover, having been quite sick for a few days, but you may recover in a week or so. But for certain populations, whether you're the very young or the very old, or you have underlying medical conditions, but also for pregnant women and people living in poorer housing and crowded conditions, this can result in very severe impacts. We have an estimated 3,500 deaths and over 12,000 hospitalizations from influenza each year. It doesn't just cause an impact on your respiratory system or pneumonia. It can cause inflammation in your heart muscle, in your brain, so encephalitis. So it is absolutely not a trivial illness. And compared to the flu vaccine, on the other hand, is that vaccines, like any other medicine, does have some side effects, but most of them, the most common ones, are not severe. They're local side effects with some pain at the injection site, redness or swelling, maybe a bit of fever and fatigue. And very rarely do people have a severe reaction. So severe allergic reaction is seen very rarely, and any other complications are serious, such as some neurologic complaints are seen in 1 to 2 per million doses vaccinated. So that's simply not true.
We have a question from Sandra Schroeder on Facebook. Should someone with an autoimmune disease like rheumatoid arthritis get the flu shot?
Absolutely. There's a lot of people with chronic underlying medical conditions, including autoimmune diseases. Certainly go and talk to your physician, but the influenza vaccine that are injectable are made by inactivated or made by little components of the influenza virus. They're not live viruses. So as long as, depending on what conditions you have, if you can generate an immune response to the vaccine, then that is a very good way of protecting yourself. And then particularly, actually, people with chronic medical conditions are one of the highest risk of influenza complications and absolutely should get the influenza vaccine. There are very, very few contraindications to flu vaccine.
Okay. PJ LaPearl on Facebook, how good is the vaccine this year?
It's too early to tell what the vaccine effectiveness is because we actually have to conduct some studies that compare vaccinated people, compare people with actual laboratory confirmed influenza and look at the vaccinated versus the non-vaccinated population, and that won't be available until generally a preliminary estimate in February of each year. Right now we do look at some laboratory results to see if there's a match to the circulating strain. That doesn't necessarily tell you fully what the vaccine effectiveness is, but we know that for the H1 strain circulating, there is a good match. For the influenza B and H3 strains, unfortunately, there's suboptimal match. But even a less than optimal match will give you some protection. So I think my advice is always to get the vaccine. Even a suboptimal vaccine effectiveness gives you another added layer of protection.
Okay.
And the downside is very small.
All right. A couple of questions, and there's one in particular that people want to know, and I'll actually just give you one question as an example. We have a few from others, but how long does it take a regular flu to run its course, and why does this strand seem to linger? It's been hovering for me for years, says Natercia Raposo on Facebook. For me, and it's hit full blown. Is it a more severe, longer lasting flu?
No, but I think influenza can really knock you out for a couple of weeks sometimes. So even a healthy adult can really be knocked down by the flu for a week. So others can, the illness can linger. But what I can recommend is that if your illness is lasting longer, you could have a complication and you should see your doctor, particularly if you have an underlying medical condition.
Okay.
So you could have a secondary pneumonia or other complications. So I think if it's particularly prolonged, then seek medical advice.
Okay. Jolene Janice on Facebook is asking if you've had flu shots in previous years or in years previous, are you somewhat protected if you haven't had this year's flu shot?
I think in general, what we recommend is that the flu shot should be given every year. And that's because the influenza strains tend to change from year to year. And the vaccine recommendations from the World Health Organization for this year's vaccine gets updated, certainly for the Northern Hemisphere, every February. And you lose your immunity to the flu shot fairly rapidly. So the recommendation is that you should get it again, even if you had it last year.
The Canadian Medical Association Journal reported, I think a few years ago, that the universal influenza immunization program may need to be reconsidered because there was evidence, or emerging evidence at that time, that repeated flu shots may blunt the vaccine's effectiveness in subsequent seasons. That was in 2015. Where have we landed on that question?
Well, I think quite recently there was a meta-analysis which is looking at the body of evidence that's available and trying to synthesize that information as a whole. And the bottom line is that the recommendation is to get the seasonal influenza vaccine. So even if you had it the year before. The results can be a bit different depending on which strain, but certainly compared to not having a vaccine, the influenza vaccine, if you give it this year, it would protect you more than if you didn't get the vaccine. For the H1 strain and the B strain, it appears that if you've got 2 consecutive vaccines, you get more protection. For the H3 strain, it's less clear. But you never know what influenza virus is going to be circulating. And the bottom line of some of those studies is that annual influenza vaccine is still the way to go. And people should go and get the flu shot. But from my perspective, I do recognize that we need to continue to study this particular question.
All right, Dr. Theresa Tam, Canada's Chief Medical Officer of Health, thank you for joining us and taking audience questions tonight.
You're welcome.